Good afternoon.
Hello.
Hi, this is Edison Bond with the Office of Patient and Guest Relations. How may I help you?
This is Melanie Silva. I'm calling about my father, Sal McDonald. I'm really upset about the care my father received. He had chest pain and shortness of breath, so I dropped him off. I had to get home to take care of my kids. I called at least 10 times to get updates, and I finally got through after about 5 hours, and they said he had gotten back into a room about 20 minutes ago. 5 hours? After that, he ended up needing a cardiac catheterization. I'm sure he had a heart attack because he was not in the room quickly enough. This is just unacceptable. I know there are a lot of sick people right now, but an older man with chest pain should be at the top of the priority list.
I am so sorry, Miss Silva.
And when I asked to be called back with more information, no one called me. Then I called back and found out he had been admitted and is now in heart failure. I expressed concern about how long it was taking him to get treatment, and they responded by telling me that other people had been waiting 9 hours. That is completely uncalled for.
I am so sorry, Miss Silva. I am sorry for the lack of communication and the rude response you got when you raised the concern about how long your father was waiting in our emergency room. This is not the way we operate here, and I am really sorry. With regard to your father's care, I understand your concerns, and we will review the care he received in our emergency room. We have a process that when a patient or family member alerts us to a problem, we have our quality department review all of the care to determine if anything went wrong and if there were any improvements we could make. I will certainly have your father's care reviewed.
Okay, well, I would appreciate that, but my father is dying. It's hard for me to get in to see him with the COVID protocols and everything, and I really feel like he wouldn't be in this situation if he didn't have that issue with the emergency room. Plus, it's so hard to get information outside of the hospital. I don't even know who I'm supposed to talk to and who is in charge of my father's care.
Yes, I completely understand that. Why don't I work on making you an authorized care partner for your father and getting you a visitor's pass? And let me see if I can reach his cardiologist and see if he can come up and meet with you. Would that help?
Yes, it would. Thank you.
Okay, great. I will work on that immediately. The visitor's pass should be all set by the end of the day, but I will call you later today and let you know. The investigation into his care will take a little longer, usually a few weeks. So I will keep you apprised of any developments on that.
Okay, great. Thank you. And please call me by the end of the day to let me know about the pass.
I will do that, and I look forward to speaking with you.
Goodbye.
Talk to you later. Good afternoon, Mrs. McDonald and Ms. Silver. Thank you so much for coming in to meet with us today. Again, I'm so sorry for your loss, and we hope that this meeting will be able to answer some of your questions and give you a better understanding about your husband and your father's care. I would like to start with some introductions, and I'll go first. My name is Edison Bond. I'm with the Office of Patient and Guest Relations.
Hi, I'm Doug Salvador. I'm the Medical Director of Quality here at the hospital.
And I'm Dr. Ibarra, the cardiologist. We spent a lot of time together back in March.
I'm Melanie Silva. I'm Sal's daughter.
I'm Sal's wife of 57 years, Mrs. McDonald.
Thanks again for coming in to meet with us. What we hope to do today, as you know, a group of doctors and nurses got together to review the care that your dad and your husband received while here. We want to explain what happened, and we're here to answer all the questions you have as long as it takes. We want to apologize where we've made mistakes, and then we'd like to tell you about things we've done and we've learned from your dad's care to try and make sure that the care is better the next time.
Ms. McDonald, Ms. Silva, I am so sorry for what you experienced here in March and what Sal experienced here in March. Without recounting everything, I think we could say that the last few months of his life were difficult. I'm going to try to give you an overview of what I think happened over the span of time in his last months, because I think his last months were not easy. During that time, he was diagnosed with congestive heart failure, a weakening of the pumping function of his heart. I think that was related to the known blockages of his arteries, as well as the heart valve disease he had had. In addition to that, he then developed a urinary tract infection and probably another infection, an infection of that artificial heart valve that he had. And during that period of time, he was in the hospital at least once and in and out of the office a few times as people tried to make diagnoses, try to help him compensate for his heart failure, and then treat the infection. That was what I would call the first phase. The second phase was the acute phase when he came in here in March, which is I think really what we're here to talk about. And that was an emergent phase where he presented with a heart attack and ultimately was diagnosed with very, very severe prosthetic valve endocarditis or infection of his heart valve.
Right, and he spent 5 hours sitting alone, feeling awful in your emergency department instead of getting the care he needed right away. He should have at least gotten an EKG right away.
You're right. I'm sorry that he waited so long. You're right. He should have been seen sooner given his condition. I'm also sorry that the staff were rude and made excuses about the reasons for his waiting. We strive to have people come in here and receive kindness and help they need. And it's always terrible disappointment when the opposite happens. So I want to truly apologize for that. Also, your father, your husband, should have gotten an EKG earlier when he came into triage based on his complaints. And we've done a number of things looking at the process in the ED to make sure that in the future that happens for every patient who comes in like your dad. I think that even if your dad had gotten his EKG in triage as he should have, because of the other diseases that were going on, and Dr. Barr will explain more, that the outcome here would have been the same. That delay didn't cause his death.
So you're telling me that even if he'd been seen right away, he still would have had a heart attack?
Your father was having a heart attack. The EKG was delayed. It should have been done sooner. He went to the cardiac catheterization laboratory emergently, as you know, after the EKG was done. That is all true. I'm afraid, however, that had we done this 5 hours earlier, the overall outcome for your dad would have been the same. Okay? His heart attack, in retrospect, was caused not by cholesterol buildup, but rather a piece or fragment of the infection breaking off the heart valve and lodging itself in the artery. I was able to open that up with a stent. But that's not your typical heart attack. And what we found, as you know, after we got him his stent, was that his infection was very, very severe, and his heart valve was leaking very, very severely on top of the underlying heart condition he had, his congestive heart failure. So the outcome in my mind, professionally, after all my years of experiences, the outcome would have been the same. The procedures would have moved faster, but unfortunately, I think he would have passed just as he did.
The way you describe how things went does not make me feel good about coming to this hospital. My dad had a terrible last few weeks. It didn't have to be like this.
I understand. We didn't give him the best care. You're right. And I'm truly sorry for that. We have reviewed the care and we've learned from this case. So we've added staff into the emergency department who are more frequently checking in with every single patient in the waiting room and redoing vital signs and checking to see how they feel so that we can more quickly identify people who need to come in and be seen sooner. And we believe that change will make it less likely that someone like your dad would come in here and wait as long as he did without being cared for.
I didn't know he was this sick. I mean, I thought they told me that he could live a long time with congestive heart failure. I mean, like a year or two. I didn't think he'd be gone so soon. Why didn't you figure this out when he came in for his checkups?
I think what you were told was correct. Oftentimes people will tolerate having congestive heart failure for a year or two. They may go along very steadily and then have a very rapid decline. Sometimes they can have a more continuous decline. I think that what Sal was experiencing back in December, January, February, could have been interpreted as solely that. At the same time, he had another process going on. He had a urinary tract infection, which was ultimately diagnosed. That can make someone of his age with his multiple medical problems mimic the heart failure and the symptoms he was having, that lack of energy, lack of appetite. But in retrospect, he had more than that going on. I think that his urinary tract infection probably caused an infection of his artificial heart valve. And in the end, it was the infection of his artificial heart valve that caused his death.
Okay, I can understand, but
Isn't there any difference between the symptoms of a UTI and the symptoms for a valve infection that you could have noticed? Or the fact that he came in to you more than once didn't indicate that there was anything wrong?
Sometimes there are differences. Sometimes it's a difference in the duration of the symptoms. Sometimes it's a difference in the intensity of the symptoms. But oftentimes there isn't a lot of difference. The urinary tract infections, especially in men at that age, can be chronic, and endocarditis can be very, very tricky to diagnose. And so, yes, there could have been a difference, but there really wasn't in his case. We were able to diagnose it when we had this, catastrophic situation. I want you to understand, though, that even if we had diagnosed it a month or two earlier, I don't think the outcome here would have been any different. All right. There's really only one way to treat prosthetic valve or artificial valve endocarditis, and that's to actually surgically go back in and remove the valve and replace the valve. And Sal's condition wouldn't have allowed that under the best of circumstances between his congestive heart failure and his kidney issues and his other issues. And that's more or less what the heart surgeon told us. So ultimately, I think the outcome would have been the same.
okay, I see.
I don't know. I understand what you're saying, but so many things went wrong here. I just feel like this place is in need of some serious help. It's always been my hospital, but I'm not proud of it right now, and I would not tell other people to come here.
Ms. Silva, you are right. We have made many mistakes. But we are here today to be honest and transparent with you and to try to do better. We do take these things very seriously, and I can see that you do too. I wonder if you may be interested in joining our Patient Family Advisory Committee. This is a committee that helps to improve care at the hospital by making sure that the patient and family voice is heard when there is new initiatives or new policies created.
That would be good. You would be good at that.
You would be outstanding at that, Melanie.
You speak so well.
But I'll think about it. I'm glad you're going to have one of those committees because it is sorely needed.
Well, I hope that you will consider it. So, Mrs. McDonald, do you have any further questions for the doctors today?
Oh, no, not right now. Maybe later, but this was a lot for me today.
That's understandable, but if you have those questions, and I expect you will, please write them down. You have my cell phone, Melanie has my cell phone. Call me and I'll try to give you the answers you're looking for.
Well, we want to thank you both for coming in, and I hope this meeting has been helpful to you And again, we are so sorry for your loss. We will continue to keep you and your family in our thoughts and reflections. And we want to make a promise to you that we will do better. We will do better.